Could you tell if someone was having a stroke? Being able to spot the early warning signs could make all the difference for you or a loved one. What is a stroke? A stroke happens when the blood supply to the brain is interrupted. In about 80% of cases, this happens because of a blood clot or blocked artery. Strokes can also happen if the blood vessel itself is damaged. Without a good blood supply, the brain cells don't get the oxygen they need to function. If the supply is interrupted for long enough, the brain cells will die. The effects of a stroke will depend on how long the interruption is. A mini-stroke or transient ischemic attack, TIA, happens when the blood vessel is just temporarily blocked. The symptoms can go away within minutes as the blood supply returns, and there might not be much permanent damage to the brain cells. A TIA can be a sign that a more serious stroke is on the way, so it is important to take them seriously and to seek help, even if the symptoms go away by themselves. About 4 in 10 people who have a TIA will go on to have a stroke. A major stroke can cause very serious symptoms, including long-term problems because of the damage to the brain cells. A stroke could even be fatal if you aren't able to get help quickly. The faster you seek help, the better the chances of a good recovery. Who is at risk? Anyone can have a stroke, but some of us are more likely to have one than others. It is important to know if you are at higher risk so that you can ensure you're aware of the warning signs. You might not be aware if you have a weakened blood vessel that could burst, but other risk factors for stroke can be screened for and often changed. Most strokes happen when there is a blood clot or blockage in the blood vessels supplying the brain. Luckily, many of the factors that increase the risk of these kinds of blockages are under our control, so you can take steps to reduce your risk. You are more likely to have a stroke if you are overweight, you smoke, you drink a lot of alcohol, you have high cholesterol, your blood pressure is high, you have certain conditions such as diabetes or atrial fibrillation. Eating a balanced diet, getting regular exercise and enjoying a healthy lifestyle can help to lower many of these risks. If you want to find out your stroke risk, then you should talk to your doctor or arrange health screening. Getting your blood pressure, cholesterol levels and other factors checked can tell you if you are more likely to develop a blood clot or to have a blocked artery that could cause a stroke. How to spot the early warning signs. You might have heard the FAST acronym before. It's an easy way to remember the most common warning signs of a stroke and the importance of acting quickly. Face drooping. If you ask them to smile, then it will be crooked or one-sided. Arm weakness or numbness. If you ask them to lift both arms, one will drop lower than the other. Speech problems such as slurring or difficulty repeating a sentence. Time to call an ambulance. However, there are some other possible symptoms that you should watch out for too. A sudden, severe headache. Sudden dizziness, loss of balance or coordination. Loss of vision or changes to your vision in one or both eyes, which usually happens suddenly. Feeling confused or having trouble understanding things that are usually easy for you. Numbness or weakness on one side of the body, or in one arm or leg. The signs of a stroke often appear suddenly, but that doesn't mean that you won't have time to act. Some people will experience symptoms such as headache, numbness or tingling several days before they have a serious stroke. One study found that 43% of stroke patients experienced mini-stroke symptoms up to a week before they had a major stroke. If you take note of these symptoms and seek help even if they go away, then your chances of a good recovery are much better. Don't ignore the early warning signs. You aren't overreacting if there's a change you've had a TIA. Get help right away as a more serious stroke could be hours or days away. Complications. A stroke can sometimes cause temporary or permanent disabilities, depending on how long the brain lacks blood flow and which part is affected. Complications may include paralysis or loss of muscle movement. You may become paralyzed on one side of the body, or lose control of certain muscles, such as those on one side of the face or one arm. Difficulty talking or swallowing. A stroke might affect control of the muscles in the mouth and throat, making it difficult for you to talk clearly, swallow or eat. You also may have difficulty with language, including speaking or understanding speech, reading, or writing. Memory loss or thinking difficulties. Many people who have had strokes experience some memory loss. Others may have difficulty thinking, reasoning, making judgments and understanding concepts. Emotional problems. People who have had strokes may have more difficulty controlling their emotions, or they may develop depression. Pain. Pain, numbness or other unusual sensations may occur in the parts of the body affected by stroke. For example, if a stroke causes you to lose feeling in the left arm, you may develop an uncomfortable tingling sensation in that arm. Changes in behavior and self-care ability. People who have had strokes may become more withdrawn. They may need help with grooming and daily chores. Prevention. Knowing your stroke risk factors, following your healthcare provider's recommendations and adopting a healthy lifestyle are the best steps you can take to prevent a stroke. If you've had a stroke or a transient ischemic attack, TIA, these measures might help prevent another stroke. The follow-up care you receive in the hospital and afterward also may play a role. Many stroke prevention strategies are the same as strategies to prevent heart disease. In general, healthy lifestyle recommendations include controlling high blood pressure, hypertension. This is one of the most important things you can do to reduce your stroke risk. If you've had a stroke, lowering your blood pressure can help prevent a subsequent TIA or stroke. Healthy lifestyle changes and medications are often used to treat high blood pressure. Lowering the amount of cholesterol and saturated fat in your diet. Eating less cholesterol and fat, especially saturated fat and trans fats, may reduce buildup in the arteries. If you can't control your cholesterol through dietary changes alone, your doctor may prescribe a cholesterol-lowering medication. Quitting tobacco use. Smoking raises the risk of stroke for smokers and non-smokers exposed to secondhand smoke. Quitting tobacco use reduces the risk of stroke. Managing diabetes. Diet, exercise and losing weight can help you keep your blood sugar in a healthy range. If lifestyle factors don't seem to be enough to control your diabetes, your doctor may prescribe diabetes medication. Maintaining a healthy weight. Being overweight contributes to other stroke risk factors, such as high blood pressure, cardiovascular disease and diabetes. Eating a diet rich in fruits and vegetables. A diet containing 5 or more daily servings of fruits or vegetables may reduce the risk of stroke. The Mediterranean diet, which emphasizes olive oil, fruit, nuts, vegetables and whole grains, may be helpful. Exercising regularly. Aerobic exercise reduces the risk of stroke in many ways. Exercise can lower blood pressure, increase the levels of good cholesterol, and improve the overall health of the blood vessels and heart. It also helps you lose weight, control diabetes and reduce stress. Gradually work up to at least 30 minutes of moderate physical activity, such as walking, jogging, swimming or bicycling, on most, if not all, days of the week. Drinking alcohol in moderation, if at all. Heavy alcohol consumption increases the risk of high blood pressure, ischemic strokes and hemorrhagic strokes. Alcohol may also interact with other drugs you're taking. However, drinking small to moderate amounts of alcohol, such as 1 drink a day, may help prevent ischemic stroke and decrease the blood's clotting tendency. Talk to your doctor about what's appropriate for you. Treating obstructive sleep apnea, OSA. Your doctor may recommend a sleep study if you have symptoms of OSA, a sleep disorder that causes you to stop breathing for short periods repeatedly during sleep. Treatment for OSA includes a device that delivers positive airway pressure through a mask to keep the airway open while you sleep. Avoiding illegal drugs. Certain street drugs, such as cocaine and methamphetamine, are established risk factors for a TIA or a stroke. Let's end the video here. On the channel you can find many interesting videos about the benefits and harms of vegetables and fruits, as well as diseases and methods of treating them. Therefore, please do not forget to subscribe to the channel and click on the bell. I will also be grateful if you like and share the video with your family and friends. See you again.